Hi, I'm Dr. Schlott, and I'd like to help you understand snoring, sleep apnea, and its treatment options. Snoring and sleep apnea are what we call sleep breathing disorders. It's a problem with the way we breathe while we're sleeping. Now, the cause of the problem generally isn't in our nose or our sinuses. It's not down here in our throat, and it's not in our lungs. The problem is in our mouth of all places. On the roof of our mouth, behind our upper teeth, there is a pad of tissue called the soft palate. Take your tongue like this, put it behind your upper teeth, now walk it back. It's going to feel hard, hard, soft. The soft is the soft palate. Think of it as a muscle that breaks up our mouth from our airway. Now, when we wake up, this muscle automatically contracts and is held in such a position that our airway is open. That's why you've never ever heard anybody snore when they're awake. Now, when we fall asleep, our muscles don't contract, they relax. When this muscle relaxes, it collapses and makes our airway smaller. If it collapses partially, we set up a situation where we have a large hole funneling into a smaller hole. What that will do will cause the air that we breathe in to accelerate. It's because of a physical principle known as a Venturi effect. You're familiar with this. You ever put your thumb over a hose?
Yes.
The water goes faster. In this case, it'll cause the air that we breathe in to accelerate up to 80 miles an hour. So when we breathe in, it will go across this tissue, which is loose because our muscles are relaxed. The consequence is that the tissue vibrates and it creates a noise we call snoring. Another thing that can happen is that this can completely collapse and block our airway. In certain individuals, the tongue will go back and also block the airway. Now, when no air gets to our lung, that's what's known as an apnea. Apnea is Greek for without breath, so sleep apnea means during our sleep, no air gets to our lungs. When this occurs, this is what's known as obstructive sleep apnea, because we're obstructing or blocking our airway. There are two other types of apnea, but they're rather rare as compared to this. Now, I think it makes sense that if we block our airway and no air gets to our lung, that the oxygen level in our blood would fall. And that's what happens. While we're sleeping, the brain registers this drop in oxygen and it goes, uh-oh, we've got to do something or we'll die. So what happens, the brain creates what we call as an arousal. The arousal will have two parts to it. The first part, it's going to make us do something to get air in. For most people, that something is to kind of go and gasp in air. And you've probably woken yourself up doing that before. The second part of the arousal has to do with the way we sleep. We sleep in a cycle that's divided into stages. It goes like this. We're awake. We then get drowsy. We call that drowsiness stage 1 sleep. From there we fall into light sleep known as stage 2 sleep. We then proceed into deep sleep known as stage 3 sleep. And from deep sleep we go to what we call REM sleep, rapid eye movement or dream sleep. From REM sleep we go back to drowsiness. So it means all night long we're going through these sleep cycles with these stages of stage 1, 2, 3, REM, 1, 2, 3, REM, 1, 2, 3, REM. You should go through all these stages all through the night. But if you have sleep apnea, that pattern gets broken with consequences. So here's what happens. We're awake. We start getting drowsy. As we get drowsy, our muscles relax. We fall into light sleep. It collapses. It blocks our airway. No air gets to our lung. Our oxygen level falls. The brain senses it, creates an arousal. We then gasp in air. Then when we do that, it causes us to reverse our sleep cycle. We go back to stage 1. So I tend to go 1, 2, 2, 1, 1, 2, 2, 1, instead of going 1, 2, 3, REM. So the consequence of all this is that you sleep 7 or 8 hours and you wake up and you're tired and you need a cup of coffee or something to get going, or you need a nap during the day. The reason is because you're not getting enough stage 3 sleep. That's deep sleep. That's where the body heals itself from the rigors of the day and hormones and things are produced. So the consequence of all this is that besides being tired, there are other consequences to your health if you're not sleeping properly. Does that make sense?
Yes, it does.
It's pretty simple.
Yeah.
Now, when it comes to treatment, there's basically 2 treatments that we use to treat this condition. The first one is a CPAP, and what it involves is a mask or maybe perhaps a nasal pillow. It has a hose and it connects to this hose here, which is actually a machine, which is a compressor. Now, what it does, it's going to blow air pressure in here and keep the tissues apart. What I want you to think of it is like running water through a hose so it won't leak. It's not rocket science. This is probably our most effective treatment because we can treat the widest range of patients with it. The problem with CPAP is that it's difficult to get used to, and most people, or at least 50% of the people, won't use it. So CPAP is very, very effective, but the problem is, like I said, people won't use it. I liken it a lot to losing weight. I don't think there's any secret to losing weight. You just have to eat less and exercise more.
Right.
But how many people will do it?
Right.
You know, there are some who will, but a lot won't. And it's kind of like with CPAP. Another way to treat you is this way. If we move your jaw forward like this, there's a reflex action that keeps this muscle from collapsing. I guess this is a simple way to show you how it works is make a snoring noise for me. Can you go? Okay, now move your jaw forward like this. Now try to snore. You can't. It's almost impossible.
Okay.
That's the idea. So how do we accomplish that? The way that we accomplish that is to make a retaining-like device. Remember, your teeth go like this. We want you like this. So we make a retaining-like device, one that fits on the upper and one that fits on the lower. And this one happens to have wings, this model, and it holds your jaw forward while you're sleeping. Now, people ask me, well, is this uncomfortable? And I go, well, yeah, but you're sitting down now. If I was to sit like, you know, without a chair here, it'd be uncomfortable.
Right.
Because the chair's doing all the work. But when this is in your mouth, if it's doing all the work, you don't even know your jaw's forward. And they go, well, is my jaw going to get stuck forward? And I go, well, you can sit down in a chair for quite a while and walk away. And the same thing here, you can take this out in the morning and you're still going to go back and be able to chew your teeth. Now, the difference between an oral appliance, what this is called, and a CPAP is the fact that we can't treat everybody with this. It works for certain people and not others. Generally, it works for mild and perhaps low moderate patients. And that's why a CPAP is more valuable because we can treat all ranges of patients. The problem is, like I said, is that a lot of people won't wear it.
Yeah.
Now, I said there are only really two treatments, this and the CPAP. Well, we developed a third one, which is a hybrid between the two. And that would be to use both of these. And we call this a custom CPAP mask. Now, most people have tried CPAP and they find the problem is with the mask. The mask involves, it's acrylic, and then here there's some latex or silicone. And what you have to do is you have to take these straps and strap it down to make a seal. So when we blow the air pressure in, it's going to push the tissues apart. But if you have a leak, then it's not going to work and it's going to wake you up. The problem with the stock mask is that when you make your seal, if you sleep on your back, you're fine. But if you roll to your side, your hair or something's going to pull this and this is going to lift. And you're going to get air leak, and it's going to wake you up, and or your bed partner, and you're going to be unhappy.
Yeah.
So to get around that, we've made a custom mask. Now you'll notice here, there's no silicone. We can make it really pretty. You know, this happens to be my wife's. But you notice here that there's no silicone here. What we do is we make a mold of your face. So this is custom made to fit your face. What happens is that we use material that is so accurate that when we duplicate your face, we're going to make a seal that is much, much superior to the silicone. What happens is when we blow the air pressure in, the tissue comes over this and it creates a vacuum seal. And then what happens is you can, we then connect it to your teeth so it can't move.
Okay.
So what I'm going to do is put one on I've made for myself, and I want you to try to move this. We have this, so you can move around. You can sleep on your side, your stomach, you can sleep standing on your head. I don't care.
Okay.
You can't move, but I want you to try to move this. All right.
Oh, yeah.
You move my head before this moves.
Right.
So the problem with the custom mask is that it's on the expensive side because it takes a lot of labor to make this. We only have one lab guy in the country right now that I know of who makes this. and it takes 6 to 8 weeks. So this is the treatment of last choice. But I really like this because, for people who truly need CPAP, we can actually treat them and they can sleep better and have a healthier life. Now, I know I've given you lots of information, but it isn't that complicated.
Right.
So do you have any questions?
I do like the fact that this one is more mobile. That way you can kind of move around. I can see where this one would be. It'd be a little more difficult to sleep with because you'd have to stay on your back. Obviously, if you moved around, it might leak out and not do what it's supposed to do. So, yeah, it's very interesting. And then you'll get better sleep, right?
Yeah, that's the whole idea, to sleep better and be
Sleep better,
healthier.
yeah, and healthier.
So if anybody out there has any questions, this is obviously, a simplified version of what happens. I would encourage them to ask their doctor about this and get more information.
Yeah, awesome. Well, thank you for the information. That's great.
And thank you.